Hello and welcome to Clinical Hypnosis Bendigo podcast. I am Michael Pattinson, a clinical hypnotherapist based in Bendigo. This podcast is about one thing: helping you understand clinical hypnosis through evidence, research, and practical experience. There are many myths about hypnosis. Some people think it is mind control, others believe it's magic or something only see on stage shows. Because of these misconceptions, many people who could benefit from clinical hypnosis never consider it. Today we're going to separate fact from fiction. By the end of this episode, you'll understand what clinical hypnosis really is, how it works, what science says about it, and whether it may be appropriate for you. Let's get into it. Many people contact me after trying everything else. They read books, they watch YouTube videos, they try willpower. They try to stop smoking. They try to lose weight. They try to reduce anxiety. They often find themselves returning to the same habits. Eventually, they ask a simple question: can hypnosis help me? The answer isn't always yes. Clinical hypnosis isn't a miracle cure. It isn't suitable for every problem, but for many people, it can become a useful part of a broader treatment plan. Understanding why starts with understanding how the brain works. What is clinical hypnosis? Clinical hypnosis is a focused state of attention. That's all it is. During hypnosis, your attention becomes more focused and less distracted by what's happening around you. You probably experienced something similar already. Have you ever driven home and realized you don't remember part of your journey? Or become so absorbed in a good book that you lost track of time? Or watch a movie and forgotten everything happening around you? Those are everyday examples of focused attention. Clinical hypnosis deliberately uses that natural ability to help people work on specific goals. What hypnosis is not? Let's clear up some common myths. Clinical hypnosis is not mind control. No one can make you do something against your values. You remain aware throughout the session. You can usually hear everything that's being said. You can stop the session if you choose. You're not unconscious. You're not asleep. You do not lose control. In fact, many people say they simply feel deeply relaxed while remaining mentally alert. Stage hypnosis versus clinical hypnosis. People often confuse stage hypnosis with clinical hypnosis. They're very different. Stage hypnosis is entertainment. The goal is to make the audience laugh. Clinical hypnosis is health care. The goal is to help someone improve their well-being. Stage hypnotists usually choose volunteers who are enthusiastic and willing to participate. Clinical hypnosis focuses on the client's goals, whether that's reducing anxiety, stopping smoking, improving sleep, or changing unhelpful habits. Different purpose, different setting, different outcome. What happens during a session? People often ask me what happens during a typical session. First, we discuss why we come. We talk about your goals. We discuss your history. We'll decide whether clinical hypnosis is appropriate. It is. I'll guide you through relaxation and focus attention exercises. While you relax, we use carefully chosen language that supports the changes you are trying to make. There is nothing mysterious about it. It is a structured conversation during a state of focused attention. What does research say? This is an important question. Clinical hypnosis has been studied for many years. Research suggests it can be helpful for some conditions when used appropriately by trained professionals. For example, there's evidence supporting hypnosis for helping people to stop smoking, reducing anxiety, managing stress, improving sleep, managing some types of pain, helping people prepare for medical procedures. Researchers continue studying where hypnosis is most effective and where it should be combined with other treatments. It is important to remember that hypnosis is not a replacement for appropriate medical or psychological care. It is often used as a complementary approach alongside other evidence-based treatments. Why habits are so difficult to change? Many habits operate automatically. This is about think about trying your shoes, driving your car, brushing your teeth. You don't consciously think about every moment. Your brain has learned those patterns. The same is true of many unwanted habits: smoking, emotional eating, nail biting, negative self-talk. Clinical hypnosis aims to help people become more aware of those automatic patterns and support them in building healthier ones. Who can benefit? People seeking clinical hypnosis for many different reasons. Some want to reduce anxiety. Others want to help stop smoking. Some struggle with stress at work. Others want better sleep. Some want greater confidence before public speaking. The important point is this: clinical hypnosis is always tailored to the individual. No two sessions are exactly alike because no two people are exactly alike. Who should be cautious? Clinical hypnosis isn't suitable for every situation. A qualified practitioner should always take a proper history before beginning treatment. Sometimes another healthcare professional is the best place to start. Good clinical practice means recognizing when hypnosis is appropriate and when another approach is needed. Practical advice. If you're considering clinical hypnosis, ask yourself 3 questions. What change do I want to make? Am I genuinely ready for that change? Am I willing to participate in the process? Clinical hypnosis is not something that is done to you. It is something you actively participate in. Your motivation and commitment are important parts of the process. Today we explore what clinical hypnosis really is. It is a natural state of focused attention. It is in mind control. It is in sleep. It is in magic. It is a clinical tool that may help people address certain problems when used appropriately and alongside evidence-based care. The most important thing is to seek information from qualified professionals and rely on evidence rather than myths. Thank you for watching. Thank you for listening to the very first episode of Clinical Hypnosis Bendigo podcast. In our next episode, we'll explore how hypnosis affects the brain and explain the neuroscience in a clear and everyday language. If you found this episode useful, please subscribe so you don't miss future episodes. If you'd like to learn more about clinical hypnosis or arrange a consultation, visit the Clinical Hypnosis Bendigo website. Until next time, take care, stay curious, and remember the last change often begins with understanding how the mind works. Thank you for listening.